cover the gamut of contraceptive options, okay? So we are going to talk today about starting from like the least effective forms going to the most effective forms of contraception. We have to talk about today is spermicide and barrier methods, right? So condoms are highly effective, right? And they also protect you against sexually transmitted infections. So any of these forms of contraception that we talk about, we want to make sure that you still are using your condoms for barrier method to make sure you're protecting yourself against some forms of sexually transmitted infections, okay? Your condoms are only 80% effective at preventing pregnancy, okay? So there is a pretty high failure rate associated with condoms, and that's just because of user error, maybe the condom breaks, all of those things. Just remember though that you have your plan B available to you over the counter, so you just have to go to the pharmacy and get your plan B if there is an incident such as that, okay? Now we're gonna kind of go into the realm of combined contraceptive options, okay? So in the world of contraceptive options, there are kind of two main options. It's combined contraception, which includes estrogen and progestin together, okay, to prevent pregnancy, versus progestin-only options, okay? So when we start going into our combined options, we talk about several different ways to deliver those couple of options, okay? One option is a patch, right? So some patients really enjoy the patch method. So they'll use their patch once a week for 3 weeks and they'll take it off and then they have their withdrawal bleed, okay, for that 4th week, okay? It's about 98% effectivity, okay? So it kind of means the same as you would for your combined oral contraceptive pills. So it's really just kind of a patient preference and whether or not maybe you go to the gym a lot and whether you can wear that patch, okay? And then we talk about just the good old-fashioned pill or oral contraceptive pill. That again is a combined contraceptive. It has estrogen and progestin together, okay, in order to help prevent pregnancy. It's about 98% effective at preventing pregnancy. So that's your combined oral contraceptive pill. Now, as far as risks and benefits, there are a certain subset of population that can't use a birth control pill, right? So our smokers over the age of 35, patients who may have migraines with aura, patients who have history of stroke or blood clot, those kinds of things may prevent you from being able to use a combined oral contraceptive pill. But that's why we have lots of other options to make sure that we find the right fit for you. And then within the pill category, we also have something called a progestin-only pill. Some of our ladies might remember that maybe while they were breastfeeding. We tend to use that progestin-only pill while you're breastfeeding just because it doesn't tend to affect your breast milk supply. It, however, is not quite as effective as our oral contraceptive pill. It is only 95% effective at preventing pregnancy with perfect use, okay? Within that combined contraceptive category, we also have some other options to deliver that medication, okay? So one of those is called the NuvaRing. Again, this is branded product, okay, just because there's not a generic of this particular form of medication. So what happens is that patients will place this in the vagina, it sits up in there for 3 weeks at a time, comes out for that 1 week of withdrawal bleeding, and you get a new one. Within that ring category, we also have a newer product that's come out called Annovera. Again, it is a branded product because it is brand new, essentially. So this is a ring that's actually approved for 1 year of use. So you get basically 13 cycles out of it, okay? So very flexible. So this is a newer product. You can always ask us those questions and see if it's something that you might potentially want to try, okay? And then we have a medication that kind of bridges the gap between kind of our daily medications or weekly medications before we really get to our long-acting reversibles, and that's our injectable form of contraception called Depo-Provera. And so that's a progesterone only, okay? So it is an injection that you get to have every 3 months, and it's also about 95 to 98% effective at preventing pregnancy and has some other side benefits as well. So the next category is one of my favorite categories. It's called long-acting reversible contraceptives, also known as LARC, okay? So within our long-acting reversible contraceptives, we have kind of 2 main ways to deliver that, okay? So one is called the Nexplanon, again, branded products because they're non-generic. The Nexplanon is a progestin only, so it's a tiny little bar, right? About 4 centimeters. What happens is it goes underneath your skin, so we put it right about there-ish, okay? And so we're gonna put it in your non-dominant arm, generally, okay? And what happens is you can actually feel it under your skin, so you know it's there, okay? And the nice thing is that this is actually the most effective form of contraception, okay? Then we start talking about our intrauterine devices. That's a little T device that goes up inside of your uterus and sits there, okay? So within our IUD category, we actually have 2 kind of main subsets. One is our progestin only, and one is our non-hormonal form at all. The one that has no hormone whatsoever is actually called the Paragard or Copper T. She's actually approved for 10 years of use, which is good longevity out of a device, okay? So 10 years of use. So even though these devices are approved for however many years I say, it doesn't mean you have to keep them in for that long period of time if you don't want to. Some of our ladies just use it for pregnancy spacing. You know what, I had my baby, I don't want to have a baby for like 2 to 3 years, so I'm going to get a device in, then take it out, and then you're back to your baseline fertility, okay? And then again, within our IUD realm, we also have our progestin-containing IUDs. So the progestin-containing IUDs has multiple different options as far as your daily dose of progestin, okay? So kind of our oldest device that we have a lot of data about is the Mirena, okay? So Mirena and Liletiv, actually, those are the two devices that have the same dose that they release every single day. One of the nice side effect profiles for those two devices is after about 6 months, 50% of patients don't have periods anymore, which is a fabulous side effect profile, okay? A lot of women say, well, is it okay for me to not have a period while I'm on a birth control option? And it's okay as long as we are manipulating that cycle, okay? If you are not on any form of contraception and you don't have a period, that is a different conversation for another day, okay? But we need a phone call about that. Within that progestin or levonorgestrel containing IUD, we have a slightly lower dose called the Kyleena. She has almost the same rates of amenorrhea, meaning no period after about 6 months, but slightly lower dose of progestin, and it's a slightly narrower device. She's approved for 5 years of use as well. So again, good longevity out of that particular device. And then again, within that levonorgestrel IUD category, we have the Skyla. She's approved for 3 years of use, still that same effectivity at preventing pregnancy, but slightly smaller device, lower dose of progestin, so you're generally still gonna have a regular period with that particular device, okay? And then of course we start talking about our sterilization options, okay? So if you are interested in no more babies whatsoever, I don't wanna have to take anything, I don't wanna have to have anything put inside my uterus or my body, etc., then of course we can offer you surgical management, okay? So the way that we do the sterilization procedure for ladies these days is called laparoscopic bilateral salpingectomy, okay? So that means that we are taking out both of your fallopian tubes completely, okay? So there's no tubal tissue left for anyone to reanastomose later, right? We treat sterilization as permanent, non-reversible, okay? All right, ladies? If you ever desire a pregnancy after sterilization procedure, you're looking at in vitro fertilization, which is an expensive prospect, okay? So you want to make absolutely positively certain no more babies, okay? Now remember, sterilization also comes with risk of failure, right? There's no such thing as 100%, right? So we still will counsel our patients. There is potentially a 1% chance over your lifetime you could still potentially get pregnant, okay? And again, there is that potential risk of regret associated with the sterilization procedure. Man, I wish Dr. Woods had not taken out my fallopian tubes, okay? But that risk tends to be up to about 30% less than the age of 30 and decreases significantly after the age of 30. And then of course there's the vasectomy, right? So the safest thing for you is a vasectomy for him, okay? So again, vasectomy is highly effective, not quite as effective as our bilateral salpingectomy, but still highly effective. And again, his procedure is much easier for him to do, right? His anatomy's out there, it's all hanging out, right? So it's a lot easier for him to have a vasectomy done than it is for you to have a sterilization procedure. However, if he has a vasectomy and then you potentially get divorced later on, then you still have to think about contraception if and when you find a new partner as well. So that in a nutshell that's all of our options for contraception at this point in time. Hopefully we'll find some new things here in the future, but this is what we've got for now. So we would love to help you figure out which is the best option for you.